Yeah, thank you. Well, thank you very much, first of all, for allowing me to have this opportunity, and apologies for the interruption, Jim, but I had to, sorry. Just to tell people who I am, I'm Hassan Shehata, I'm the Clinical Director for Women and Children at Epsom Hospital. I'm also a National Institute of Clinical Excellence Committee member. I'm also the author of the Royal College, so many times being quoted, Workforce Committee. As you all know, that we've been here before. 10 years ago, I was the chair of the investigation group in the maternity services in our trust, and the outcome of the review was very clear. Epsom and St. Helens maternities are safe and sustainable and required for the number of women delivered in this area. Since then, the pressure on our maternity services has increased. There is no doubt about it. We need to modernize, and we've been doing that. There's a further clear rise in number of deliveries by about 5% per year. We have risen to the challenge, achieving NHS recognized accreditation and recommendations to a higher standard. I had a very good meeting with some of the senior members of the CCG a few days ago, but I was disappointed to learn that despite having a good meeting, that a letter has been sent yesterday stating that our figures are good because we live in a posh area. And that the women are well. Obviously, the CCG members know very well that any figures for maternal morbidity or mortality are corrected for the social demographic area. As part of the network agreement, we have also been told that we're also very good because we transfer all our patients to St. George's. Epsom transferred less than 1% of their women, and actually all to St. Heliers, because of the network arrangements about the neonatal age limit. St. Heliers have not transferred a single baby out. So it's a myth that we transfer our babies or women to St. George's. But let me tell you about BSBV, because I think that's really quite important for me to mention, and I know Claire has been very kind to allow me to do this in this very packed meeting. I have been a member for several years for BSBV and the clinical working group in the Southwest London. As a clinical-led process, there will always be inevitably disagreements. But as a clinician in the maternity group, I was not satisfied that my views have been heard and properly considered, and that the models have vigorously been considered. The models proposed lacked clinical coherence, and some clinicians concerned about safety and affordability were not included. We also look at the workforce, and there's a lot of big discussion about the workforce, and again, no much work has been there. Consistency in approach has been lacking as well. So the proposal change, as mentioned by my colleagues, are 4 points, and that's the BSBV. What are the current problems? Number one, we do not meet best practice clinical safety standards. It is suggested our quality indicators do not meet that. 3 weeks ago, the RCOG published quality indicators about Epsom and St. Helens and other hospitals in the country, and we have passed with flying colours. Actually, we're in the top 15%. Perinatal data, which was mentioned in a letter by the CCG yesterday, that our data are so good because we transfer all our patients. And as I said, these are corrected normally for the social demographic area. Our rate is 2.1 per thousand compared to the national average of 5.4. So we're actually half the rate.
Thank you, Mr. Shehata.
We comply with the RCOG workforce, but this is really quite important, that's where I interrupt.
Mr. Shehata, I'm really conscious of time. One more point.
I will, sorry. With the RCOG, the Royal College says very simply, if you have a 6,000 delivery or more, then you need to have 24/7. If you have 2,500 deliveries or less, you only need 40 hours. We comply at Epsom. For St. Heliers, you need to be 60 hours now, 98 hours in a year's time. We comply. As a matter of fact, Epsom and St. Heliers are the only 2 hospitals in South London and Surrey that comply with the RCOG guidelines. Finally, the so-called London Health Programme, which is where all this trouble is coming from. That program suggests that we need to have 24/7, irrespective of the number of deliveries. No evidence for it, the college does not support it, and it was brought in, as a member of the LHP has told me, who has been kicked out, was brought in to close down hospitals.